It is spring cleaning and yard work season, and for many, that can mean aches and pains.
Yeah, that's right. Today we are talking about chronic low back pain and treatments people are seeing all over social media. Joining us to talk more about this is Dr. Robin Raju, a Yale medicine psychiatrist and assistant professor of orthopedics, as well as rehabilitation at Yale School of Medicine. Good morning, doctor, and thanks so much for being here.
Good morning.
Thanks for having me. Always a pleasure.
Always a pleasure, of course. Well, a lot of people, it's that time of the year. People are getting out into the yard to do some work. And a lot of people get back pain when they overdo it. But for others, this is kind of a consistent, ongoing pain. So, doctor, can you outline the difference for us between temporary soreness and chronic back pain?
Great question. As you know, it is very common to have back pain. 80% of us will get it at some point in our lifetime. Like you said, the question is it something smaller, like a sore, or is it something chronic? The timeline is the key here. I usually tell my patients if it's something small, a muscle sore, it should go away in a couple of weeks. But, if it's something lasting more than 3 months, you should definitely have it checked out by your physician. Again, what you're worried about is something not concerning behind your back pain. You just want to make sure it's a muscle or a disc issue and not necessarily cancer or infection or fractures. Again, and the only other tip I give my patients is make sure you don't have any strength issues in your legs. Again, a lot of people talk about pain down the legs, numbness in the legs, but what is more concerning sometimes could be strength in the legs. So that's when you get the chronic pain realm.
Absolutely. And we see everything online these days. So now, of course, there is a surge of holistic treatments that people are seeing online or maybe even turning to, everything from supplements to yoga to acupuncture. What are some of the approaches that are actually evidence-based?
Yeah, there is a plethora of holistic medicine out there, like you said. Unfortunately, modern medicine runs out of medication, injection, surgery, not great for chronic low back pain. So out of all the holistic medicine, I would say core strengthening with physical therapy has the most amount of evidence. Again, getting your muscles in your belly, in your back, in your buttock really strong, that really makes a big difference. Now, there is so many other, like your yoga, your acupuncture, your cognitive behavioral therapy. All these things have some evidence, but none of them have robust evidence. And you talk about supplements. There is over 500 in the market, and they all have some evidence, but again, not robust evidence. You always want to check in with your physician before you delve into it.
Absolutely, and like we've been talking about throughout this conversation, we see a lot of different trends on social media. Doctor, are there any signs that we should look out for before we decide to try one of these trends or treatments that we're seeing online?
Yeah, one advice I always give, I know holistic medicine sounds very safe, but you just want to make sure there are contraindications. Some of these things are not so safe. Let's say, for instance, manipulation, very benign sounding, but if you have cancer or fracture, it's not for you. For acupuncture, if you have an infection, it's not for you. And a lot of the supplements in the United States, 60% of them are inaccurate. What is on the label and what is inside the bottle is not the same. So you should always, tip is always, I know physicians tend to be a little condescending towards holistic medicine, but you should always run it by a physician. Make sure you don't have a contraindication before trying one of these on.
All good advice, doctor. Thank you so much for your time.
Thank you.
Thanks for having me.
Of course.